Hi, my name is Dr. Saravana. I'm a consultant vascular surgeon in Pantai Hospital Kuala Lumpur. Peripheral arterial disease means reduced blood flow to upper limb or lower limb. Worldwide prevalence of peripheral arterial disease has soared by 72% from 1990 to 2019. Just to give you something easier to relate to, we all know diabetes. It has a prevalence of 11.2% in 2011, but in 2019 it's become 18.9%. That means 1 in 5 person living in Malaysia has diabetes or is pre-diabetic. Now, here's the problem. 20% of these diabetic patients tend to develop a peripheral arterial disease. That makes them 1 in 5 diabetics having peripheral arterial disease. On a scale of death threats, you are 2 to 3 times more likely to die from cardiovascular related deaths when you have peripheral arterial disease. Now, one of the common symptoms you might have read about or you've heard about is called claudication, a term coined for symptoms of reproducible muscle cramp or pain encountered with exercise or walking, relieved with rest, and returns when subject is subjected to the similar activity. But this is found only in 10% of patients with peripheral arterial disease. So majority of them present with rest pain or tissue loss or gangrene. Those with continuous pain, gangrene or poor wound healing are already inflicted by severe peripheral arterial disease. The idea of screening the general or at-risk population is with the use of ankle brachial systolic index or ABSI, toe brachial index TBI, and toe pressure. ABSI of those with the range between 0.9 and 1.4 or toe brachial index of more than 0.7 are considered normal, and those who have less or equal to 0.5 are considered severe peripheral arterial disease. Those with the symptoms of peripheral arterial disease but normal ABSI can be further tested with stress ABSI, just like stress ECG, where patient can be placed on 6 minutes walking exercise and the ABSI repeated shows a significant drop, usually more than 20%, and that is deemed significant. Those with toe pressure of less than 30 mm mercury with poor healing wounds also are deemed to have significant peripheral arterial disease, and the wound is unable to heal without adequate revascularization. The risk factor group are those with smoking, hypertension, hyperlipidemia, those with end-stage renal failure and organ injury such as stroke, ischemic heart disease, myocardial infarction, diabetes, advancing age, and those with family history. We offer patients screening tests such as ABSI and toe pressure here. Those who are under follow-up for other diseases, we can even include ABSI as part of a surveillance follow-up and see over the period of the follow-up whether the patient develops peripheral arterial disease. So it can be done for various age groups as they come in for other regular tests like for diabetes checks or hypertension, hyperlipidemia checks. We can use the ABSI and toe pressure for these purposes, which is screening and surveillance. It's like someone bringing a car for service at the service center and not feeling like something's left undone. We encourage walking persons, especially those with high-risk factors I mentioned earlier, to come for a thorough assessment. A patient found to have ECG or stress for cardiac gets referred to a cardiologist, but those with ABSI and toe pressure abnormality gets referred to a vascular surgeon. If you have poor wound healing, gangrene or unexplained foot or leg pain, you can also get this assessment to exclude peripheral arterial disease. Health is wealth. The road to success requires you to walk or run to it, so check your peripheral circulation. Make sure they are at optimum levels. Now, does that mean if you have peripheral arterial disease, do you all need surgery? The simple answer is actually no. We advise patients from a simple diet and lifestyle change, proper footwear use, to oral medications. Those with debilitating claudication and limb-threatening peripheral arterial disease, we advocate surgery. Surgery could be in the form of endovascular or open surgery. So tests and consultations are mandatory to interpret and guide individual management.